Hi, welcome back to Rohrich Knows podcast, helping you become a better and more informed you when you're seeking healthcare, especially wellness and plastic surgery care. Let's talk about facelifts. Facelifts are a very hot topic now on social media, but it's really a lot of what I do every day as well, facelifts and rhinoplasty. So what matters in facelifts? I think several things matter. Optimizing results, safety, natural results, but also long-term results matter. So when you're doing facelift surgery, you should be able to tell a patient, what it is and how long it takes. And here's 11-year post-op. Just to give you an idea of a lady that had a lift and fill facelift and a deep layer and with selective fat grafting with laser resurfacing. And here she is 11 years post-op. So she's taking good care of her skin, good care of herself, and you can see, she's 11 years, her jawline is still very good, her skin is great, she looks great. She obviously has a little bit of neck laxity, and I think that certainly is something that, we could address, and she obviously is quite happy with how she looks at 11 years, and I am as well. So I think that's a very important and powerful thing to do. So, I think the power of doing facelift surgery and doing facial rejuvenation is very, very important, but you must customize it toward the patient. And how do you do that, and how do you get longer lasting results? And I think that the best way to do that is obviously analyzing the patient's aging process. Like in this lady, she had droopy eyelids, sagging eyelids, and she had puffiness in her lower eyelid, so we did an endoscopic brow with upper and lower lip blepharoplasty, shaping along with laser resurfacing. So customizing the procedure to the aging of the patient. That's very, very powerful. And then you want to do a holistic approach. Not only are the eyes that are aging, but it's her lower face and shaping her jowls and her neck area. So the key is doing a lift and fill facelift, doing a deep layer facelift, selectively adding fat in the areas that she lost fat in. That's very, very powerful to do in these patients. And that's exactly what we did here. And obviously, like I said, at 11 years, she still looks excellent, but she has some recurrent laxity of her neck, skin, which she doesn't want to address right now. But these types of procedures should last between 8 and 12 years. She's 11 years post-op, and you can see. The big thing I see in these patients is that you also have to do your part. That means maintenance, sunscreen, sun avoidance, using retinols, vitamin C, and exosomes, and all these powerful skincare have been used to make sure that your skin looks great to match your underlying skeletal structure. And I think that's a very powerful method to look at. So it's these maintenance things that have helped her look good for so long, and I think that's very, very powerful to do. So, deep layer facelifts are important. So are selective central facial fat augmentation, and you can apply these to every patient, but every patient is different. So that's the most important point I want to make. That's why you need to find someone who understands the science of aging, who's an expert in facelift surgery, who can not only talk about it, but deliver excellent reproducible results. And I think that's fantastic. And here's a recent patient of mine that had both a facelift and a rhinoplasty done together. And you can see, you can shape and contour the face and rejuvenate him. You can take off 10 years on these patients, and I think that's really powerful. And that is very, very important to do, because every patient's procedure is so different based upon her style of aging and her aging in her jawline or aging in her face. And I think that's really the power of understanding how the face ages for you to actually get a good result. And I think that's very powerful. So here she is before and after at 6 weeks with her rhinoplasty and face and neck lift. She's got nice jawline, nice shape of her cheeks, and good structure of her face, and really nice mandibular border. And I think these are all things that actually make someone look great and natural, and not look like they've been in the face protect. We're in the face protection program, not the witness protection program for facelift surgery. And I always tell my patients that. So you want to look natural, you want to look like you. And here's another patient, similar type of procedure, but completely different because she has a fuller face, and she's 6 months after her deep layer facelift, and she had selective central facial fat grafting, but she had a deep layer facelift on the outer aspect, and really gives you the shape and contours that she wants. And she's at 6 months post-op, and I think, you know, again, you have to stylize the patient to the patient's facial aging and her structure of her face. And I think that's very, very powerful to do. So you can see, you know, here she is pre and post-op. She looks youthful, she looks beautiful, and it looks like her. Those are really the most important things that you want to accomplish. You don't want to look like someone else. She looks like she did 10 years ago. And that's really the power of facial rejuvenation done well, you know, with a deep layer lift and fill facelift. And I think you can see that, you know, obviously she had her eyes done with her facelift as well. So I think the power of analyzing her aging process, her cheek jowls and her jowls and her neck, and reshaping them, restoring them, is the magic to getting long-term results that look good now and look good in 8 to 10 to 12 years. And I think that's really what you want to do. So the key in facial rejuvenation is understanding the science of aging, customizing each procedure to the specific patient so you can deliver natural, long-term results that are consistent, safe, and reproducible. So know before you go, find a board-certified plastic surgeon or facial plastic surgeon that has expertise in this area, and then go see them, look at their results, talk to them, make sure they operate in an accredited outpatient surgery center. Obviously, safety and outcome are key. So give me your comments, give me your thoughts, give me your questions, and on my or DM me on my social media. So remember, stay safe and be very well informed. Know before you go. Have a great one.